Hey everybody, I'm Marlon. Welcome to my channel, Marlon's 420. This evening I was going to talk about a question that I get asked a lot as an individual who has suffered with and had temporomandibular joint disorder for over 10 years. A lot of people have asked me and come to me with the question of, do I have TMJD? And it's an extremely common question I see on Facebook, Reddit, and other YouTubers get it a lot. Excuse me. And one of the most frustrating things about having temporomandibular joint disorder or TMJD or getting it treated or doctors and all that is there are no set data, no set criteria for diagnosing TMJD. Like if you go online and you look up how is it diagnosed, how to diagnose TMJD, um, almost all of them, the Mayo Clinic, blah, 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 they'll say your physician, oral surgeon, or whoever it may be will do a physical examination, ask you about your medical history and what's going on, etc., etc. There are some very specific conditions or symptoms that come with it. The one that was most obvious for myself personally was my jaw would lock and I would literally have to wrench it open and it would pop, making audible noises when it did so. What caused my problem to the point where I went looking for surgical solution was sitting in a dental chair and having to open my mouth. It was too tight, locked up. I popped it and something gave way, tore, whatever you want to call it. And that's what sent me into a very bad place. But mine was doing that for months and or years before that. Not necessarily even causing pain, just a lock, pop. And it was a normal thing until it wasn't. So that can be a sign or a symptom. Um, but there are no, those were mine. But there are no set criteria like with cancer or maybe Hopkins disease or uh, Huntington's, many other types of diseases and disorders. They have set criteria for diagnosis and stages. You can say, this is how far along you are into this, and this is what we can do to treat it. Now, if you've gotten to a point where the joint is severely damaged or injured, then you can have MRIs done by oral surgeons to look at the joint, see where it's sitting, see what kind of damage it has had, what kind of if it's arthritic, etc., etc. But it's such a small joint, and the technology doesn't really get us where we need to be to have a lot of knowledge about the joint itself, which is why a lot of surgeons will start to perform one surgery and wind up performing a different operation once they get in and see the joint. Or they'll tell a potential patient, I want to go in and do this surgery. It looks like I can do this, but I won't know for sure until I see the joint when I open you up. Now, on some surgical operations, that's fine. But with this, it's too small. There's too many things that can go wrong. They have to mirror each other to work properly. It's a complex situation. But the reality of the answer is I don't know. You can go to an oral surgeon, you can tell them your symptoms, tell them what's happening, and most likely, they can diagnose you. But every single person is going to disagree slightly on when TMJD might need to be, when intervention may need to take place, what type of intervention is best. if surgical should be first. There's no agreement amongst the medical community on how to treat this issue. And it's super frustrating, and it's a shame. And I don't know what the future of it looks like. I've been dealing with this for 10 years now, and I really thought we would have made progress. But I don't see any. Not that I can find. So, anyways, do I have TMJD? Um, if your if your face hurts, if your jaws are locking and popping, if you have facial pain all over your head and face, if it feels like somebody's pushing your face in the wrong directions all the time, and your joints don't operate properly, you may. It's very possible. Um, you know, my main thing would be, don't, I would almost say, don't go looking for a treatment, don't go looking for a cure, don't go looking for a doctor to give an opinion and start messing with things unless you're actually having pain, discomfort, and or you can't manipulate your mouth and jaw properly, it hurts to eat, etc., etc. Obviously, at that point, you need to try and do something. But if you don't have pain and you can manipulate your joints properly and everything, this is a can of worms that can get opened up. And I don't know if it ever closes again for the vast majority of people, unfortunately. Anyways, let me know what you think. Let me know how you were diagnosed, when you started having issues. Let me know the beginning of your issues. When did you start thinking, what's wrong with my face? Why does this keep happening? And then the journey you had to being diagnosed. Just let me know. I appreciate all the new subs. If you haven't subscribed yet, please do so if you're enjoying. If you've learned anything. I'll be doing more and more of these videos about my journey over the last decade, dealing with TMJD, the failed surgery I had, and everything else, the chronic pain that came along with it. I'm going to be delving into all of that. So anyways, let me know what you think in the comment section below. Hit the like button and hit the subscribe button when you can. My name's Marlon. We'll be back soon. Marlon out. Thanks.